Good evening. My name is Cliff Kahili. I'm the city manager for the city of Mesquite, and I want to welcome everyone to our community health forum. We've done a series of these as part of our Recovery Mesquite initiative to try to just bring some information to residents and to the community about different topics related to individual health, mental health, and a lot of other topics. Tonight, we are talking about men's health. June is Men's Health Month, and we'll be focusing on some common issues that affect men and what to look for as men age, the heart health issues, and some hopefully some good diet and exercise tips for leading a healthy lifestyle. Our panelists tonight are representing Dallas Regional Medical Center and are all providers of the hospital's affiliated clinics. And they're listed as the Dallas Medical Physician Group. And I'll go around and ask everyone to introduce yourselves as we go around, and then we'll start the questions. So Dr. Hariri, if you'd like to go ahead and start off.
Yeah, hi, my name is Mazen Hariri. I work at Dallas Medical Physicians Group over in Mesquite, and I have some topics I'll be talking about. Did you want me to go ahead and start those right now?
Let's go around and introduce everyone, and then we'll get back.
Sure.
Dr. Anusionwu, am I close?
Oh, hi. I wasn't sure of how we're going, but yeah, I'm Dr. Anusionwu. I'm a cardiologist with Dallas Medical Physicians Group. I do both interventional cardiology and endovascular interventions. I am a Texan by heart, and I'm very excited. Team, I'm humbled. Topics.
Well, great. Carrie?
Hi, I'm Carrie Phillips, and I'm a family nurse practitioner at Dallas Physicians Medical Group as well. Very excited to be here. Thank you.
Well, again, thank you everyone for being on the call. And this is one of those topics that I think, a lot of people would say men just don't take a very good care of themselves, or don't take time to look into some of the things that are happening to them. So, as somebody who's apparently aging myself, so it's probably good information for a lot of people in my age group. So, Dr. Hariri, we'll start with you. Basically, as a primary care physician, what are some of the typical issues you see regarding men's health, and what are some of the ways that they can be prevented or treated?
Sure. We see a variety of things that are bringing men in these days, but they do have a lot in common, and and a lot of the remedies for them have a lot in common as well. So I'll try to mention them, and then try and mention what things are that we could do to improve them. And a lot of times men are trying to have a little bit more energy these days. They want to sleep better. They want to have a little less aches and pains in their, back or muscles, joints, things like that. And they also want to prevent long-term disease and illness. And so they want, a lot of guys want to just come in and check on their health. And so the good thing is that some of the things that we do to prevent long-term disease are some of the things that can help good sleep and get better energy, and also improve their mental health as well. So just listing the top causes of death actually for men, basically heart disease, cancer, unintentional injuries, chronic lung disease, and strokes. And these are listed from the CDC, which is the Center for Disease Control and Prevention. And so many of these things can be improved as far as lowering your risk for them by lifestyle changes. And that's lifestyle changes is kind of a term we use when we talk about what you do on a daily basis, your daily habits and how you live. Whether you have risky behavior with the activities you do, and what you put in your body and what kind of exercise you do. So things like smoking can increase your risk of having long-term disease. And if you'd like to, quit or cut down, and you haven't been able to do so successfully before, I would definitely make an appointment with your doctor. You're probably going to hear that come up quite a bit. Make an appointment with your doctor if you have any, need to improve on this, or if you haven't been able to do it on your own before. Increasing your risk for cancers, strokes, heart disease is something that smoking is probably the biggest thing that could be improved on. So if we limit that, that's one thing that I would say is the first thing to get at. A healthy diet with a good mix of fruits and vegetables, high fiber. If you are eating some protein, I would say choosing lean sources of protein, such as fish, is going to be better than a lot of other sources. And then if you can avoid foods with added sugars or added sodium, the sugars mainly being, chocolates, snacks, sodas. Those are the big three that I always preach to try to cut down on. Sodas, a lot of people add a lot of salt to their food because it does taste better when you add salt to just about anything. But this can increase your blood pressure, and which can also lead to heart disease and strokes. So then we get to having a healthy weight. Improving on your weight into either the normal group or even lowering from obesity to even just an overweight category can improve on lowering your risk for cancers, heart disease, and aches and pains in the body, because we see so much damage that weight can do on the joints themselves, like the knee joints, back pain. And in order to lose weight, I generally tell people that it's about two things. It is about what you put in your body, and we just mentioned a healthy diet, and you can try to do a little bit more on portion control when it comes to eating healthy things. Also try to eat a good amount of things. When you're going to be full, and you may be able to cut back just a little bit and try to say no to a little bit of extra desserts and things on occasion. That's probably a good start. If you want some extra tips and things like that, we can discuss them, during, regular appointments specifically for that. But that's generally where I would start. And then as far as like the second thing would be getting moving a little bit more. Exercise is a huge thing that can help improve not just your weight, but also your heart health, and can lower your blood pressure and lower your risk for heart disease, heart attacks, strokes. So generally you want to do something that you like to do, that's fun. Otherwise you probably won't want to do it again or often. And a lot of people choose things like sports that can involve other people, something that you can socialize while doing. And that's a great thing to do. I generally tell people that for maintaining weight, usually you need about 30 minutes a day of exercise. And that's just to maintain your weight. But if you want to lose weight, you're going to probably need to do a little bit more beyond that. And that seems like a lot for people. But if you make it a priority, you can probably get a lot done and make some time for it if it's something that you really want to work at. There's a big key to losing weight and the exercise that you do is that getting your breath up and getting some actual, shortness of breath and getting winded is actually good for you when you're trying to push yourself to lose weight. If you're just doing some activity that you're having a conversation during, there are good walking programs out there and they do work. But I think that that's just a start. And if you really want to improve on your exercise capacity and try to lose weight, you really got to push yourself beyond that 30 minutes and get some higher intensity in there so that you're actually breathing a little bit more, because that's when you usually start to shed some pounds. Beyond losing weight, limiting alcohol consumption to a moderate amount can improve your health. And we talk about this to several patients a week, often ask me how much is appropriate. And I usually will tell them, if you're under 65, 1 or 2 drinks a day is usually considered moderate. And then if you're over 65, 1 drink a day. And whether that's a glass of wine, or like a 5-ounce glass of wine, a 12-ounce beer, or 1.5 ounce of a liquor that's, I think the standard is like 80 proof, but there are different strengths of those things. So that's kind of generally where you would start. But 1 a day if you're over 65, 1 to 2 a day if you are under 65. As far as putting all these things together, exercise, eating right, these can all improve your risk for these long-term diseases, but also improve how you feel on a day-to-day basis, and really improve on like your mental health, preventing depression, treating anxiety. I think we're all kind of going through a little bit of something together these days. And one of the things to look out for if you feel like you are having some mental health concerns, such as depression, are feelings of sadness, feelings of worthlessness, just losing interest in the normal things that you used to be interested in, like your hobbies or connecting with friends and things like that. And then there's your appetite changes or insomnia and some of those things that do pop up as symptoms for depression and anxiety, things that you may not have been affected by before, or you may have noticed that you've had before, but they never prevented you from doing your work or getting along with others before, but seem to be impacting your life now. So those are the things to kind of be aware of. And if they do stick out to you, I would make an appointment with your doctor and try to discuss them in a little more detail. The good thing is that a lot of these can be improved with just a little bit of work. And then if you want to, make bigger impact, it does take a great lifestyle change to reform those habits into something that is more sustainable. As far as how often a man or anybody should see their doctor, I generally think it starts with once a year annually, and starting from there, trying to figure out what each patient needs is actually an individual by individual basis. And I try to cater all of my patients to their individual needs. Because some people, if they're pretty well controlled with their blood pressure, they don't have any diabetes or anything like that, then I may see them just once a year for their annual checkup, getting a flu shot, or catching up on vaccines or something like that, and then getting annual lab tests, maintaining their colonoscopies for cancer screenings every 10 years, those types of things. But if something comes up like diabetes, I may see them every 3 months. If their blood pressure is not under control, I may see them every 2 to 4 weeks just to get it under control and make sure that we have a good plan going forward to get it under control. And then once they are showing some good results, then I'll tell them, hey, we can probably not see each other as often, and hopefully that's a good sign, I guess. But I think that's kind of where I would start, is just checking in with your annual checkup, getting to know your doctor, making sure that you advocate for yourself. If you have any questions, try to mention them during your visits, write them down, bring them to your appointments. If you have old records for things like that, bring them into your doctor so they have a good idea of what you've been going through in the past, and you can work together on something.
Well, yeah, when you're talking about doing a visit with your physician, what are some of the things that you would encourage somebody to, discuss with their doctor, or questions you would like patients to ask you?
For me, I generally like to know I like to hear my patients ask me, like, what is the timeline for, how long can I expect this to take effect? What are the side effects? Is the follow-up plan to do this, X or Y or Z? I like to have them ask me those questions, because it lets me know that they are planning ahead. And then I like to have them, be able to tell it back to me so that we're all on the same page. And when we know that we're working together on something, I can, fully understand that we left that appointment with a good plan together.
We've other forums that we've had, we've talked a lot about mental health, and I appreciate you bringing up the relationship between mental health and physical health. What are some of the things that might be kind of the serious concerns that you would say you need to go talk to somebody more quickly than just the battle with weight gain or physical effort and all of that.
Sure. I take mental health really seriously. A lot of things in this health field are very open things, like, you know, we can see obesity, we can see, a lot of times we can see blood pressure on a chart or something like that, but a lot of times we don't see the mental health side of things. And this seems to be, there's a stigma to it that people are, I feel like it's being paid more attention to now, and it makes me feel a lot better. But there are still folks who don't want to share their thoughts with others, and they're afraid of what people might think when they do share them. Some of those might be that they have really thoughts of hurting themselves, thoughts even of hurting others that they found. Some people may have attempted to commit suicide in the past or cut themselves, things like that, that are kind of cries for help, if you think about it. If you want to look at statistics, women do attempt to suicide more, but even though men attempt suicide less, they actually follow through with the suicide more. So men do commit more suicides, and it is part of the reason that men don't live as long as women, in addition to the reasons for like heart disease and those things as well. But if you're having those thoughts of hurting yourself, hurting anyone else, you're not eating, your sleep is really affected, where you're maybe getting 2 or 3 hours of sleep, if that at all. Your work is affected, or you may not even notice it for yourself. You may notice it in somebody else, and try to encourage them to go to their appointment and talk to them about their. I have had family members bring in their other family members and say, and try to push them, say, hey, men, tell them what you told me, tell them what you said to me, and really try. It's like trying to pull teeth sometimes, but when we're done sharing all of that stuff, I really have to appreciate, and I'm humbled by the conversations that I have with my patients that tell me all of this, of their concerns, and I have to give credit to the family members as well, because when they bring them in and encourage them to do it, we know that it's for a good purpose, and there's no shame in it, and we don't try to guilt anybody into it, and we try to do it on their terms, and in a way that is holistic, and with a plan that we can move forward, trying to individualize their care for their particular symptoms, and figure out what's really going on behind it.
Well, great. Thank you for addressing that, because I think that's one of the things that we're going to see is the kind of lingering effects of the pandemic, and eating out and a lot more, and not being able to get out and do all those social activities that keep us active. So I appreciate your insight into that. We'll move on to Dr. Anusionwu. I hope I'm getting that right. They gave me a cheat sheet. Am I close?
Oh, you're better than I am.
Okay, great. Well, I won't try to say it any more than I need to, just so I don't mess it up. But again, thank you for being on the Zoom today. As a cardiologist, what are some of the issues that you were seeing regarding men's health?
Thank you, Cliff. And again, I'm very humbled to be part of the panel and discussing men's health in June. It's something that is dear to my heart. In terms of cardiac issues that we do see in a cardiology office, it's actually a very wide range, ranging from simple things like chest pain to palpitations, which like irregular heartbeats, skip beats. At times we do see people that are passed out, or people that are short of breath, and they can't function. And then also we do see people that have issues with the rhythms of their heart, where they need some wiring maneuvers to help with the abnormal rhythms that they have. We also see people that have swellings in the leg that makes it hard for them to get about their daily activities. We also see people that, they try to lie down, they can't sleep because they have signs and symptoms of heart failure. So it's actually a breadth of cardiac and vascular diseases that we see in our cardiology office. And now, because of COVID-19, a lot of people have gained a lot of weight because of the pandemic. I call it the COVID weight. People are not going to the gym, even though they have some kind of exercise equipment in the house, but the inertia is not there. So right now, things have started opening up. Lots of people are trying to go back to their regular lifestyle, trying to lose weight and try to eat better. But my colleague, Dr. Hariri, really emphasized on the primary prevention strategies, which we emphasize a lot because, it's a collaborative effort between the cardiologist, the dietitian, the primary care doctor, and the patient, in terms of reducing their risk of cardiovascular disease. Because cardiovascular disease can be because I consider myself a plumber. In other words, if you do have blockages in your heart, I can suck it out, or I can open it up, put in a stent, or if you have blockages in the legs, we can do similar maneuvers. But the best way is actually to prevent them from happening. And that boils down to the same, A, B, C, D, E of preventive cardiology, where you try to reduce your risk so that you end up not having those cardiac diseases that we talk about. A lot of people have coronary artery disease. A lot of people have atrial fibrillation. A lot of people have heart failure. A lot of people have other like peripheral arterial disease, and then chronic kidney disease, which a lot of it is as a result of poorly controlled high blood pressure, though sometimes it runs in families. And then, of course, obesity is like the icing on the cake. If you come to your clinic, it's actually very difficult to see somebody that has a normal BMI. Most people are either overweight or obese. If you see somebody that has a normal BMI, it's like an outlier. So, working together with my colleagues have been a passion of mine to reduce, the chances of people needing, cardiovascular intervention. I'm happy to do them when they're necessary, but, modifying the risk factors, is extremely important, because even when we finish the interventions, we will still continue the risk factor modification, which, because I always consider an intervention like a Band-Aid. You put a Band-Aid on, but you still have to do the regular things. Otherwise, you're back to square one. So overall, we see a breadth of cardiac and vascular diseases, and we care for a range of patients, but we still emphasize on primary prevention so that, people can live a better life and enjoy what they like to do.
Well, you mentioned people putting on COVID weight and being a little bit heavier and all of that. So, when you talk about trying to prevent through diet, what are some of the recommendations you give to your patients when they're coming in and you're trying to help them with their weight loss?
All right. Thank you for that question. So, diet is extremely important, is the fulcrum of a lot of the things we do. But I always try to emphasize it's more like a lifestyle change, because a lot of people, when they think about diet, they think about it as a short-term Band-Aid, and then they go back to their regular life. But I try to encourage people to see it as a lifestyle change. At times, it's good to think about a food diary, what you eat daily or what you eat every week. You try to think about your comfort foods and try to think about things that, you can cut out from your diet to improve your lifestyle overall. There's so many diets out there, from DASH diets to Mediterranean diets to keto. There's so many diets out there, but, a lot of people, and a lot of people in cardiology, and I myself believe that the Mediterranean diet, when you mix it with intermittent fasting, helps out a lot. where, you try to, and then of course, portion control, because you don't want to eat, eating from a small plate that makes your eyes feel is big. Trying to cut out some of the trans fat and saturated fats from your meals, and cutting down the simple sugars, because we all know that simple sugars get metabolized pretty quickly and turns into fat in the body. Going with the complex carbs, whole grains, if necessary, if you do have to have carbs. But overall, the emphasis is a food pyramid where the top will be, the main things that you eat will be, fish, which is things like salmon that has the omega-3 fatty acid, and then lots of vegetables and fruits and nuts, where we emphasize good nuts like almonds and walnuts. And then there are different types of oil out there, but the best ones are the mono unsaturated oils, which include things like canola oil, where, it's easier for the body to metabolize it when you compare it to the trans fat, which is common in the donuts, in the cakes and the ice creams and the pies. And, so it's not that people cannot have those other kind of stuff once a while, but it's a food pyramid where you try to bulk up on the fruits and vegetables and the good stuff. And of course, exercise is key. But I always tell people that I always try to make it a lifestyle change where you think about diet as like 60 to 70% and exercise about 30 to 40% overall.
Well, I appreciate you including ice cream in there, that it's okay to eat ice cream, but in moderation. I think that relieves a lot of people on that. But I think when you talk about lifestyle change, I think that's, what I hear when it comes to, when we say diet, it's not necessarily that short term. It is that long-term lifestyle change that you combine with eating and exercise and I guess better attention to yourself. So when it comes to men aging and it comes to heart issues, are there any particular things that may not be heart attack related, but things that you just need to men need to watch out for as they get older? Shortness of breath or anything like that?
Yes. So thank you for that question. So one of the things we do see a lot in men as they get older in their 40s and 50s is most guys, we keep our fat in the belly. Yeah, and people start having the beer belly or the keg belly or whatever terminologies people use. And then at times people kind of slow down because you have kids and then you don't exercise as much. So we do see people coming in with shortness of breath, people having issues with low testosterone, which at times we know can be a harbinger for coronary artery disease. And then, of course, I always try to emphasize it's all about assessing the risk. What's your risk of heart disease? Your cholesterol, whether you have high cholesterol, diabetes, your blood pressure, your weight. Metabolic syndrome is also extremely important because that could include the abdominal girth in male, which is something that we do see a lot. And then if you have other risk factors like chronic kidney disease or lupus or rheumatoid arthritis or your ethnicity, those can increase your risk in general. So as men get older, a lot of it has to do with their weight. Of course, the regular screening which men have to do includes things like colonoscopy, prostate, PS. My colleagues do excellent job in making sure that's done. But most guys, the main problem is that they never go to see a doctor. So that's the main problem. So by the time they come, at times it's late, or their wife are the ones that actually make them come. So we have to just try to get the word out there that men get sick and they do need to go for regular checkup.
Cool, great. Hopefully, there's some wives watching that are going to force their husbands into coming to see their doctor. So, and doctor, thank you very much. So, we'll move on to Carrie. I think trying to wrap these two conversations together. So, when it comes to things that you see like muscle loss in men aging, when does that typically begin? What do men need to look for, and how does it really affect people in the long term?
Well, that's a very good question. And I'm also humbled to be here. So thank you for asking. It's hard to believe and it's hard to think about, but, muscle loss in men can actually start at the age of 25 years old. And when you think of somebody that's 25, that's really hard to believe. But now that's for somebody that, lives a sedentary lifestyle, probably doesn't get around very much, but muscle mass for typical people will start around the age of 30. And you can plan on losing anywhere from, I'd say, 3 to 5% per decade. So every 10 years, you can lose anywhere from 3 to 5%. And typically in an average male life, you could lose about 30% of your muscle mass. And so, so it's good to exercise and diet. And a lot of times you see that the muscle mass, you'll see as men get older, their arms and legs will be skinnier and their bellies will be, larger typically. And they start to lose the muscle mass in their arms and legs first, and then their stomachs, get heavier. And, there's some exercises you can do. Obviously, resistance training is really good. It's where you're lifting weights and, you're really pushing your body, resistance. And then there's the fitness training. Then that's where you need to get your heart rate up while you're exercising. That is very good. And then also just walking, people who walk, even typically walk, just do fast walking. If that's all they can really do, that's so much better. And it does decrease, the muscle loss over time. And then of course there's diet, and when you talk about losing weight, I think you have to be realistic about weight loss. People have a lot of, they either lack the motivation or they don't have a realistic view of how to lose weight. I think we've all been guilty of it. You'll diet for a week and then you're hitting the gym really hard. And oh my goodness, I did everything I could. And then you look at the scale, oh my goodness, I lost a pound, and so I think just being consistent. And I think one of the first steps is like having a goal. You want to have a goal, like say if I weigh 200 pounds, I want to weigh 180. So my goal is 20 pounds, just somewhere to start, and, make a plan. It's always good to have a plan. And then, as I said, be realistic. You're not going to lose 20 pounds in a week, And the other thing is just take baby steps. Don't try to run the marathon the first day. Because you'll wear yourself out. If you try to do too much all at once, you're going to be like, oh my goodness, I can't keep this up. So I think it's just taking baby steps. And, tonight I'm going to walk up and down the street and, 5 or 6 times. And then, maybe I'll do that again tomorrow or the next day. I'll go to the gym and I'll just work out a little bit. I think just building yourself up to that, is a good thing. And, form habits, healthy habits, start cooking your food, make it fun, maybe even, it sounds kind of corny, but maybe even starting a garden and growing your own vegetables, that can be rewarding. It can be good for your mind, body, and soul, not just, and it's very rewarding. And, typically you should plan on thinking about losing maybe 1 or 2 pounds a week. That's a good place. And then I think Dr. Hariri said this earlier about making it fun, like finding something that makes it fun. Like that will really motivate you. Like, it could be stand-up paddleboard. It could be joining a baseball or a softball, some type of ball team or what have you not. things like that. And, just, being realistic and keeping it fun and just trying to avoid as much as you can the muscle loss, basically.
Well, I think, you kind of centered on creating those opportunities for lifestyle changes and, finding those different activities and bringing, kind of finding those ways to be active that may not be exercise. And that helps with the mental side of it. So just going back to muscle loss, just real quick. Is there a way to try to gain it back with exercise and diet? I mean, can you recover what was lost over the years?
Oh, absolutely, you can. Yes, yes. And you can recover. I mean, I'm not going to say that, if I exercise every day, I'm still not going to lose. You're not going to lose muscle, muscle as you age. But maybe instead of losing, 3 to 5% every 10 years, maybe you just lose 1% or, 1.5%. Or maybe instead of over a lifetime, you lose 30% of your muscle mass, maybe you only lose, 15% or 10%, I mean, but yeah, just because you've lost some doesn't mean you can't get it back. It's resistance training, fitness training, cardiovascular training, and, just all that will really help with that. And of course, what you put into your body as well, avoid the sugars, the fast foods, things like that. We all, I think at this, in 2021, we all have a pretty good idea of what we should be eating. And I'm sure we're all guilty. And, even like Dr. Anusionwu said, you can't just completely deprive yourself. That's unrealistic too. You're never going to, I think you'll be setting yourself up for failure. It is okay to have a bowl of ice cream or, a piece of pie, just not 12 pieces of pie, things like that. So anyway, yeah, you can get it back.
Well, Carrie, thank you for that. And I think it's just that's one thing that, when we were kind of planning these things, we talk about health and cardiac. Muscle loss is one of those things I don't think a lot of people realize that, is that sign of aging. So thanks for addressing that. That was kind of new to me on those topics. So at this point, we're going to go to some Q&A, and we've got a couple of people on the call. So if you have a question, feel free to put it into the chat, and we'll try to answer. And we've got a couple of questions. So when and I'll whoever wants to answer these, feel free. So what are some of the, everybody gets that craving late at night, and you've just, it becomes difficult. So what are some of the best nighttime snacks, to kind of cut that craving and not, instead of going for the bowl of ice cream?
I don't know, I'll kind of jump in. I'm a big fan of almonds and pecans, carrots, and occasionally I'll have some crackers and some sliced cheese or something like that, because they fill you up really well. I know that there are, a lot of snacks out there. I mean, I typically tell people when they go grocery shopping to stick to the outsides of the grocery store, because that's where like all the fresh foods are on one side. There's the dairy aisle, and then you've got your breads on the other side, and then everything in the middle seems to be stuff that just doesn't go bad and can stay good in a box, which somehow seems wrong. And crackers and chips and all that stuff seem to, are in those aisles, and it's really tempting, and that's where like cookies are and everything like that. So those are really like high in sugar, and they might fill you up and make you feel like you're satisfied with all the sugar. But that's what Dr. Anusionwu had said about, those simple sugars really get metabolized into fat so easily, and then you're not going to burn that weight, that fat, those carbs, because you're just going right back to sleep. So I typically would say something like along those lines of like an almond or pecans for myself, and those, because those have a little bit of protein in them. They don't quite spike your sugar, and they make you feel full pretty easily. And you always won't go wrong with something to drink, like some water or some milk. So that's probably good too.
I completely agree with what Dr. Hariri said. I do like almonds and walnuts a lot, and they help a lot, especially with the night cravings. And in addition to that, a suggestion is things like a Greek yogurt that has high protein and very low sugar. And then in addition to that, could be things like carrots and celery, which are vegetables that can fill you up and you go to bed, not hungry.
Carrie, any other tips?
I like it. I guess I'm crazy, call me crazy, but I like the celery with the peanut butter. That's one of my little go-tos, maybe just kind of putting some peanut butter in the middle of a piece of celery, and it's very filling. And, it kind of, if you have a little bit of a sweet tooth and a crunchy tooth, kind of in the middle of the night, a little bit goes a long way. So yes, I agree with both of them. Yes.
Yeah, I like the apples with peanut butter as well. That's a good
one.
There's something about the yogurts that they've tried to trick us into thinking, oh, it's non-fat yogurt, but they do put a lot of sugar in them. And so I am at this point, I'm just recommending no sugar added yogurts and non-flavored yogurts completely, because there's so much added sugar in them. You can always find something to add to your yogurt, like some chopped apples or something like that can sweeten it a little bit for you and make it go down easier. But that is it's a little trick that they play on us to make it taste good, when we know that sugar is just going to be metabolized into fats. And I think there's a lot of foods that are marketed that way, and we're all kind of we're aware of it as health providers, but I think a lot of people are thinking that it's good when it's probably doing a little more damage.
I think my experience is you always have to read the labels, because there's stuff that they say is healthy has a lot of hidden things that are going to affect you in many other ways. So, All right. Next question is for somebody who drinks a lot of coffee. So what's a lot, and what do you recommend to balance it out? And how much water should we be drinking?
Well, that's a coffee. With coffee, typically in a healthy person, I would suggest no more than 4 cups in a day. And that might sound like a lot, but probably 2 to 4 cups of coffee. I would not exceed that at all. And I would definitely stay away from the energy drinks. And then if you're going to do that, I would be careful with the tea. Coffee's not the only thing that has caffeine, so, and I would avoid sodas at all cost, and, limit my tea, and I would kind of keep it in balance. Maybe not 4 cups of coffee, maybe 2 cups of coffee and maybe a glass of iced tea or something like that, or tea, hot tea, whatever. And typically I would say about 8 glasses of water a day, something like that.
I think there's actually a study that says some coffee is good for your heart health, but I don't have the name of the study by heart now. But coffee is not bad for your heart, but everything in moderation, is all that matters. If you know that coffee gives you palpitations, then hey, that's that's a no-brainer. But when you wake up in the morning and you need to function and you need a cup of coffee, I think that's reasonable. I personally don't, I think a cup a day is usually what I tell my patients, but anything more than 2, I think at times gives me a buzz myself. So,
I have a similar,
try to stick to 1 or 2 at the most, really. But coffee is not bad for your heart, except if you do have palpitations and it's, then of course they say don't drink it before you go to bed, because the studies have shown that if you drink it in the evening, at times you don't go to bed on time and you may not get 6 to 8 hours of sleep at night, because that is what is recommended, that, the average male, average adult should have 6 to 8 hours, or some people just say 7 hours of sleep. That's enough time for your brain to reset and helps men produce testosterone, and also helps you relax and helps you lose weight.
I totally agree. I think that's exactly, the recommendation, to, as long as it doesn't interfere with your lifestyle, your sleep, or cause any side effects, and it keeps you, having enough energy to get through the day, then less than 5 cups or less, like Carrie was saying, is probably good. And then as far as water, would you ask us about water consumption as well?
Yeah, that's just what's how important is good hydration, and how much is enough or too much?
Especially right now in the summer months, staying hydrated is super important. I don't know how many people are outside that much, if people are still quarantining or anything, but they used to say 8 glasses a day, and that's still around the right amount. But it is different for everyone. There are some people who maybe need to drink a little bit less, based on maybe they have blood pressure medicine that's working to keep fluid off of them, and so we try to tell them to monitor how much they drink. But in general, I tell people, actually, and it may sound strange to tell them this, but to look at their urine, and if their urine is really dark and that dark yellow color, then they need to stay, be hydrated. If their lips are constantly dry, if they're feeling lightheaded, then they need to drink more water. If they, if your urine ends up being, clear and you can see through it, it's more in the white or clear range, not as much dark yellow, then you're probably drinking enough water. There is water in coffee most of the time. But it does tend to dehydrate you in the long run. So mix in some water if you're going to drink some coffee.
Well, that was my exact question. I was going to say, can I count my 3 cups of coffee towards my water intake? So thanks for addressing that. So
Sure.
Last question is going to kind of focus on some of the exercising. And so it says, when you say resistance training, do you mean weightlifting or push-ups or pull-ups or elastic bands? Where should we go when it comes to trying to get that resistance in?
Yes to all 3 of those. Yes to anything that causes you to lifting weights, or that's pushing your body. Yes. Push-ups, definitely. Resistance bands, yes. And yes to weightlifting.
So someone starting out, again, having maybe sat through the pandemic and watched a lot of Netflix. So just kind of getting started into some of those exercises. What are, is weight important, or repetition? Where should somebody start when they're getting back to getting active?
Well, I guess it depends on how. I would start with walking. Maybe some walking, then turn it into fast walking, and then maybe carrying some of the little weights, and then now if you're used to all that, I think it depends on the person. If you're somebody that's used to working out, and then, but if you're somebody that just hasn't ever really worked out and never done anything, I would think with starting small and working your way up, for sure.
I completely agree with what Carrie said. And, you learn how to crawl, walk before you run. So, coming from COVID-19 pandemic, where people have not been exercising, starting slow, but being consistent is very important. And the goal is just like Dr. Hariri had said, where you try to get 30 minutes of exercise every day. And the guidelines you say about 150 minutes per week. So if you want to do 30 minutes every day for 5 days, or if you're feeling like a superstar, you want to do 45 minutes, but at least trying to get aerobic exercise. Whenever I say aerobic, I try to give my patients examples of what aerobic exercises mean, because some of them will go to the gym, they will lift weights, and then they will go. You know, so I always try to let them know they have to try the steps, the elliptical, the bicycling, the rowing, the swimming, you know, and then at times you see them rolling their eyes, that they never go to areas. You know, so, but I think I always try to emphasize the aerobic exercise is what really has been, you know, hampered on the guidelines and in general. I mean, resistance training is great, but I always either throw it at the end or at the beginning, but make the aerobic exercise the kind of fulcrum of your exercise regimen while you're trying to get your cardiovascular health in order.
Great. Well, everyone, I really want to thank you for your time tonight. We record these, and we hope they have a longer life for the people who couldn't join us. And we want to get some messages out. So I think great information, great insight from each of y'all. And I want to make a special thank you to Dallas Regional Medical Center for their support. And also just for what the entire group did over the past year. There were a lot of heroics from the staff, especially the emergency room group, and the whole hospital kind of became a great partner for the community and really stepped up to the challenges. And we're really proud of what Dallas Regional has done in the community and what they mean to us, especially here from the city of Mesquite. So again, I appreciate them, and I appreciate each of you for being part of our recovery program. So we plan to do these monthly, and we'll be announcing our next topic at another here in the next few weeks. And so again, everyone, thank you for your time tonight, and we'll see you around the community. Thank you.
Thank you all. Thank you.
Thank you. Thank you, everybody.
Thank you.